Why do we care about Medicaid? Even if you don't have Medicaid, Medicaid affects you. So zooming out here, this is a health insurance program for people with lower incomes. And in Michigan, it covers about 2.5 million of our 10 million Michiganders. That's a big chunk of our population. And our state budget has, the biggest single item in our state budget is actually Medicaid, our expenses on Medicaid. And about 70% of that part of our state budget comes from the federal government. There are a lot of proposals on the table in Washington, D.C. about ways to change how Medicaid works. And the budget resolution that has passed multiple times now in the U.S. House of Representatives is demanding an $880 billion cut over 10 years in the budget of the Energy and Commerce Committee, which our Congresswoman here in Washtenaw County, Debbie Dingell, she's a member of that. And there is no way to make that level of cuts without cutting Medicaid and cutting the number of people who are covered, implementing hurdles and roadblocks for people to try to sign up and maintain coverage in Medicaid. So Debbie Dingell, our Congresswoman, is screaming from the rooftops, sounding the alarm. She's been talking about this along with the governor for weeks and weeks, months and months, ever since the first budget resolution was passed at the federal level. And we've been screaming it from the rooftops here in Washtenaw and Jackson County. This is going to be bad. Now, there will be cuts of some level. We don't know how much because the pushing back that you're doing has been working. I don't think, yes, give yourself a hand. I don't think we can hope for zero cuts. I don't think we can push back all the way and have no cuts. There will be cuts to Medicaid. The problem is we don't know what type of cuts. Will it be that we're changing how much the federal government puts in versus how much we put in as a state? Are we going to be just throwing up roadblocks for people to prove that they're working, even though the majority of Michigan Medicaid beneficiaries are already working, and spend hundreds of millions of dollars to create those roadblocks, which is not an efficient use of money? So there are some proposals that are on the table that are more widely accepted in Washington, D.C. So we know that we will have fewer Medicaid dollars this coming budget than we did in the past.